everybody, it's Tony Robbins. Look, if you're over the age of 30, this is a message for you. You know, time we're in our mid-30s, our bodies begin to have a change in our different levels of our hormones. And as that begins to happen, we start to see changes in our body. And some of them can be very frustrating. It can be in a position where you feel like you're putting on body fat and you're working out like a crazy person, or your diet hasn't really changed and you can't understand what's going on, or a lowered sense of energy, or a lower level of strength, or a lower desire, your lowered libido, or maybe difficulty with sleeping. And a lot of people start to think that that's just I'm getting older, which is total BS. It's just a change in your hormone levels. And there's so much misinformation out there about hormones that I thought I'd give you 3 quick myths and kind of give you some alternatives to them. First myth I'll cover is that your hormone therapy can wait until you're in your 50s to do it. The reality is around 35, men start losing 1% to 2% of their testosterone every single year. That may not sound like much, but within a few years, you really start to feel it. Most men have gone through this experience, know what I'm talking about, that loss of drive, that lowered sense of energy, or again, that stubborn fat that you don't seem to be able to get off your body. And what happens for men is they think, oh, I don't know what to do, I'm just gonna work harder. But doing what doesn't work doesn't change it. We have to look at what's happening within our entire biochemistry. Women in early 40s, and sometimes as much as late 30s, start to go through perimenopause. Instead of waiting until those symptoms are unbearable, you want to do something sooner, but you want to know what's real. For women who start earlier, it's been clinically proven that it affects bone density, cholesterol levels, and even dementia in women. Staves it off if they start earlier. If they wait later, then what happens is, if they wait into their 50s, they might have half their life dealing with these difficult side effects that happen in the body as the body changes in this area. So for both men and women, the most important thing is to check. So at Lifeforce, you can work with one of our medical doctors. They do some very simple blood tests, and they can find out exactly where you are. Second myth I hear all the time is, well, testosterone therapy creates an increase in cancer risk. And that's just not true. When I went to the top researchers, they said, no, there's not a single study or trial that's demonstrated this. We use an abundance of caution at Lifeforce. We do PSA tests on men along the way to make sure there is no possibility, there is no change. And then the third myth that you'll often hear people is injections are the only method that works. But obviously there are creams, there are patches, there are a whole variety of ways this can be delivered. But you need a doctor that's going to sit down with you and figure out your lifestyle, who you are, what your unique biochemistry is to make that happen. So my message is go to an expert, which we have at Lifeforce, so you can figure out exactly where you stand. Why cheat yourself out of years of greater strength, greater energy, greater vitality, better sleep, more libido when you can make a change very quickly?